Scientists at the National Centers for Disease Control in Atlanta today released the results of a study which shows that the lifestyle of some male homosexuals has triggered an epidemic of a rare form of cancer. Robert Bazell now in Atlanta.
In the 1980s and 90s, an invisible monster ravaged many men's heart in the LGBTQ community. HIV and AIDS diagnoses were rampant, striking both fear and confusion into the hearts of those affected. Since the late 18th century, people who identify as homosexual have been villainized in the society. However, this came to an apex in the late 1980s and 90s when AIDS and HIV spread rapidly through the community. The LGBTQ community was attacked by the virus violently, and the people in the community watched their own friends turn their backs on them. Through research and with the help of doctors, politicians, and social reforms, people broke barriers and broke stereotypes of the disease, leading to outreach programs to save victims, as well as help support an ongoing fight for the LGBTQ human rights and legislature. HIV is the virus that causes AIDS, acquired immunodeficiency syndrome, and it's one of the world's most serious problems and development challenges. Statistics have shown that nearly 37.9 million people around the world are diagnosed with HIV or AIDS in 2018. HIV is a virus that attacks the human body's immune system, destroys white blood cells, and lowers your immune system, and decreases your ability to fight other viruses that attack your body. The virus can be spread by human body fluid, injections, blood, or mother to offspring. The first case of verified HIV was reported in 1959. It was a blood sample from a man that lived in what is now Kinshasa, Democratic Republic of Congo. Researchers later found out the first transmission of SIV to HIV was around 1920. Scientists believe that the transmission occurred when humans ate the monkeys for resources and was infected by the blood. The transmission happened in Belgian Congo, now known as Kinshasa, in the Democratic Republic of Congo. There are about 1.1 million people living in the U.S. diagnosed with HIV or AIDS. 1/7 of the people are unaware that they have HIV or AIDS. Even though the epidemic is relatively small compared to the other countries, but it's heavily concentrated among several specific populations. The victims of HIV and AIDS has dropped drastically since the outbreak of the epidemic in the 1980s and the 1990s. In 2017, 66% of the annual new HIV infections occur among gay men and other men who has had sexual contacts with men, also known as MSM. Most of the victims are African American, Black men, followed by Latino or Hispanic men, heterosexual African American, Black female, young people, and transgender women of all ethnicities are also getting tested HIV positive. During the outbreak of HIV and AIDS, people have been discriminating against the LGBTQ community for a long time. The outbreak happened just 12 years after the Stonewall Riot ended. The Stonewall Riot was an event that happened in 1969. Police would go into a gay bar and raid the bar. Members of the LGBTQ community fought back to the police because at that time, the Homosexual Act was still illegal in the US except Illinois. Many people during that time were homophobic and discriminated against the community. From the start of HIV and AIDS epidemic until 2016, nearly 700,000 people died because of AIDS-related illness. Former President Obama created the U.S.'s first national HIV and AIDS strategy in 2010. The strategy was updated in 2015 and will continue to run into 2020. It's structured around 4 core aims: reducing new HIV infections, increasing access to care, and improving health outcomes for people diagnosed with HIV, reducing HIV-related viruses and health inequities, and achieving a coordinated national response to the epidemic. 1981 AIDS and HIV epidemic took hold in the US. It surged through communities that the straight world didn't want to see, which was the LGBTQ community. The virus secretly made its way to America with no intentions. HIV killed a young man in St. Louis named Robert R. just 1 month before the Stonewall Riot. It wasn't until the late 1970s when HIV strain that started in North America started to make its way to the US from Zaire and Haiti. At that time, the sexual revolution was in a huge crisis and HIV was attacking the LGBTQ community silently but deadly. MSM was and still are disproportionately impacted by HIV because HIV transmits through anal sex more easily than vaginal sex. The first official government report on AIDS was on June 5, 1981. In the Morbidity and Mortality Weekly Report, a government bulletin on baffling disease cases stated this: in the period of October 1980 to May 1981, 5 young men, all active homosexuals, were treated for biopsy. Confirmed pneumocystis carinii pneumonia at 3 different hospitals in Los Angeles, California. 2 of the patients died. The report was villainizing the LGBTQ community because most of the world were homophobic during the epidemic's breakout period. The report gave tensions that only homosexual men would be diagnosed with AIDS or HIV. During the epidemic's outbreak, Americans would discriminate the HIV victims. They think that HIV is a stigma, shame, and fear the victims of HIV. HIV is also majorly associated with people that are homosexual, drug addicts, and sex work, which are all the things that the majority of the citizens despised. Some of the nurses and doctors would even refuse to give care to HIV patients. People hated the victims with AIDS and HIV. They would discriminate against the victims. They thought it was a God's punishment because they did something wrong or because they are homosexual. Ryan White, a teenager who was diagnosed with AIDS at the age of 13 after receiving a blood transfusion because he had hemophilia. He lived in Kokomo, Indiana, and was just given 6 months to live. When White tried to return back to school, he was discriminated in his home community. Ryan's mother, Jean White Ginder, and him rallied for his right to attend school, then gaining national attention. He then became the face of public education because of AIDS. Ryan White lived 5 years longer than he was expected to live and passed away on April 8, 1990, and just months before Congress passed the legislation bearing his name in August 1990, naming it the Ryan White Comprehensive AIDS Resources Emergency Act. When Ryan was diagnosed with AIDS, Jean decided to let Ryan stay at home because she thought he was too sick to go to school. But Ryan begged his mother to let him back to school, so his mother agreed. Jean tried to put Ryan back to school, but people started to discriminate him. Because AIDS at that time was widely known, people started spreading rumors that Ryan must be gay, or he has done something bad or wrong and it was a God's punishment. So the school made a decision to reject Ryan for returning back to school. Then the two moved to Cicero, Indiana, and was welcomed by the community. A young girl named Jill Stewart helped Ryan to be more accepted in the community. Jill brought medical experts and educated the students in Cicero, and the kids went home and educated their parents. In Cicero, he was just like a normal kid. He went to school, received education, hung out with friends, went to school events just like a normal teenager. A few months after Ryan's death, the Congress enacted the Ryan Comprehensive AIDS Resources Emergency Act in 1990 and was reauthorized in 1996, 2000, 2006, 2009, and 2013. The act was the centerpiece of the federal government's effort to improve the quality and availability of care for individuals and families that are affected by AIDS and HIV. Even though no one has found the cure for HIV and AIDS, people have come up with many different ways to lower the chance for HIV and AIDS from spreading. Truvada, for PrEP, is a medication that would help reduce the chance of getting HIV. Scientists invented a newer and more efficient way to test for HIV and can be used to test at home. Antiretroviral therapy has gotten so good that HIV is just a condition today. Statistics have shown that HIV is not just a disease to the LGBTQ community, but it can also spread through heterosexual sex activities too. It's more commonly found in the LGBTQ community because the virus spreads more easily through anal sex than vaginal sex. 1973, Maryland became the first state to legalize same-sex marriage after a same-sex couple applied for a marriage license in Minnesota but got denied, and the case went to state's Supreme Court. Ever since then, the LGBTQ community received more recognition as time passes. The community received more rights as the years go on. In 2015, the U.S. Supreme Court ratified same-sex marriage in all 50 states during the court case of Obergefell versus Hodges. Two integral aspects of ourself that should never lead to discrimination and or abuse are sexual orientation along with gender identity. For a long time, people have discriminated against the LGBTQ community. Nonetheless, people in the community have more rights than ever before. LGBTQ people are battling for their civil rights in Congress, courtrooms, and on the streets with parades and peaceful protests. Despite the community advancing onto American mainstream, LGBTQ people still face discrimination in many areas in the world and will continue to do so. Despite this, the LGBTQ community will definitely get more accepted to the world as the world develops.